Heart attack signs in women that are easy to miss. Most people think a heart attack always looks dramatic, like someone suddenly grabbing their chest, falling down, and everyone rushing around. But real life is not always like that, especially for women. Sometimes the warning signs are quiet. Sometimes they are confusing. Sometimes they feel like stress, tiredness, acidity, flu, or just a bad day. And the sad part is, many women ignore these signs because they are used to taking care of everyone else first. A mother may think, "I'll rest after cooking." A wife may think, "Let me finish this work first." A grandmother may think, "It's probably just weakness." A working woman may think, "I'm just stressed." But sometimes the body is not asking for rest. Sometimes the body is asking for help. This video is for education only and does not replace medical care. But if you or someone near you may be having heart attack symptoms, please do not wait. Call emergency services immediately, like 911 in the United States. Because with the heart, every minute matters. 1. Chest discomfort may not feel like movie-style chest pain. Chest pain is still one of the most common warning signs of a heart attack, but in women, it may not always feel like severe pain. It may feel like pressure. It may feel like squeezing. It may feel like heaviness. It may feel like fullness in the middle of the chest. And sometimes, it may feel mild. That is where many women get confused. They may say, "Maybe it's gas. Maybe I ate something wrong. Maybe I just need to lie down." But mild does not always mean harmless. A heart attack does not always shout. Sometimes it whispers. So if chest discomfort comes with sweating, nausea, shortness of breath, jaw pain, upper back pain, dizziness, or unusual tiredness, please take it seriously. You do not have to diagnose yourself at home. That is the doctor's job. Your job is to listen to your body and get help early. 2. Pain may appear in the jaw, neck, back, shoulder, or arms. Many women do not feel heart symptoms only in the chest. The pain can travel to the upper body. It can appear in the jaw. It can appear in the neck. It can appear in the upper back. It can appear in the shoulder. It can appear in one arm or both arms. Sometimes it can even feel like stomach discomfort. This can be very misleading. A woman may think jaw pain is a dental problem. Back pain is from sleeping wrong. Shoulder pain is muscle strain. Stomach pain is indigestion. But sometimes these are warning signals from the heart. This is why it is important to notice the full picture. Jaw pain with sweating. Back pain with nausea. Shoulder pain with breathlessness. Arm discomfort with chest pressure. These combinations should not be ignored. Many women are strong. They tolerate pain. They keep going. But strength does not mean staying silent when your body is warning you. Real strength is getting help on time. 3. Shortness of breath can happen even without chest pain. This is one of the signs people often miss. But in women, it can also happen without strong chest pain. You may feel like you cannot get enough air. You may feel winded after very little activity. You may suddenly need to sit down. You may feel uncomfortable breathing normally. You may feel like something is just not right. And because there is no strong chest pain, many women think it is anxiety, weakness, age, or stress. But sudden shortness of breath should always be respected, especially if it comes with tiredness, nausea, sweating, dizziness, or pain in the jaw, neck, back, or arms. Think of it this way. If your breathing suddenly feels different from normal and you cannot explain why, do not dismiss it. Your body may be giving you an early warning, and early action can make a big difference. 4. Nausea, indigestion, or heartburn-like feeling can be a warning. This sign is very easy to mistake. Some women feel stomach-related symptoms during a heart attack. It may feel like nausea. It may feel like vomiting. It may feel like indigestion. It may feel like burning in the chest. It may feel like acid reflux. It may feel like upper stomach discomfort. And because acidity is so common, people often ignore it. They may take an antacid. They may drink tea. They may lie down. They may wait for it to pass. Sometimes it really may be acidity. But sometimes, especially when it feels unusual or comes with other symptoms, it may be more serious. For example, nausea with cold sweat, heartburn feeling with shortness of breath, indigestion with jaw pain, stomach discomfort with dizziness, vomiting with chest pressure. These are moments where you should not guess. Please get medical help, because no one should lose precious time thinking it is just acidity when the heart may be involved. 5. Unusual fatigue can be more than normal tiredness. Everyone feels tired, but heart-related fatigue can feel different. It can feel extreme. It can feel heavy. It can feel like your body has no energy for even simple things. A woman may feel exhausted after walking a few steps, after taking a shower, after cooking, after climbing stairs, or even while sitting. And many women ignore this because they are used to being tired. They may say, "I didn't sleep well. I'm just getting older. I have too much work. I'll be fine after resting. But unusual fatigue, especially when it is sudden or new, should not be ignored. Your body knows your normal level of energy. So when your energy suddenly drops in a strange way, pay attention, especially if fatigue comes with shortness of breath, sweating, nausea, chest discomfort, dizziness, or pain in the upper body. Sometimes the heart does not speak through pain. Sometimes it speaks through exhaustion. 6. Cold sweats and dizziness are important warning signs. Another warning sign is breaking out in a cold sweat for no clear reason. This is not normal sweating from heat or exercise. It can feel clammy, sudden, uncomfortable, almost like your body is under stress. Some women may also feel dizzy, lightheaded, faint, or shaky. Again, these symptoms can be confusing. People may think it is low sugar, dehydration, stress, or weakness. And yes, sometimes it can be. But when cold sweat or dizziness happens with chest discomfort, breathlessness, nausea, jaw pain, or unusual fatigue, it should be treated seriously. This is not the time to be shy. This is not the time to say, I don't want to trouble anyone. Your family would rather receive one urgent call than regret one delayed decision. Call emergency services. Let professionals check you safely. 7. Why women often delay getting help. This is the part we need to talk about honestly. Many women delay help because the symptoms do not feel serious enough. They are used to ignoring their own discomfort. They may take care of children, husband, parents, housework, office work, and everyone else before themselves. They may feel guilty asking for help. They may think, what if it's nothing? But listen carefully. Getting checked and finding out it was not a heart attack is not a mistake. Waiting too long when it is a heart attack can be dangerous. You are not wasting anyone's time by calling for help. Your health matters. Your life matters. And the people who love you need you here. 8. When to call emergency services. Call emergency services immediately if chest discomfort lasts more than a few minutes, comes back, or appears with other symptoms. Also, call if there is sudden shortness of breath, jaw pain, neck pain, upper back pain, arm pain, stomach discomfort, nausea, vomiting, cold sweat, dizziness, faintness, or extreme unusual fatigue. Do not wait for the pain to become severe. Do not wait to finish work. Do not wait to sleep it off. Do not drive yourself if a heart attack is possible. Call emergency services. In the United States, call 911. The most important message is simple. Heart attack symptoms in women can be subtle, but subtle does not mean safe. Chest pressure matters. Jaw pain matters. Upper back pain matters. Shortness of breath matters. Nausea matters. Cold sweat matters. Sudden unusual fatigue matters. So please, listen to your body. And if a woman in your life says, I just don't feel right, take her seriously. It may be nothing, but it may also be the warning that saves her life. Because sometimes a heart attack does not arrive like a loud alarm. Sometimes it arrives quietly, and the body whispers, something is not right.